To our channel today. Today we are going to talk about 10 top lies in hypertension treatment and management. As we know, hypertension, also called the more common name for hypertension, is we always called high blood pressure. It is when the blood pressure was checked over three times in different ways. Over three times in different days, if the blood pressure is above 140 over 90, then the patient will be diagnosed as hypertension. Hypertension is one of the most common disease, and it is chronic. All over the world is hypertension, and the complications contribute 9.4 million deaths. So the treatment for hypertension is quite important actually. In our daily practice, when you talk with the patient and you got the feedback from the patient, and sometimes you got the feedback from your friends around you, we see a lot. We found a lot of stories. We heard a lot of stories from them, and then here we choose the 10 top lies in hypertension treatments and the management. Top 10. The high blood pressure is harmful to you, so the blood pressure is the lower the better. The truth is the blood pressure, especially for the systolic, is between 110 to 140. It's ideal, and if the systolic if it's higher or above to this standard, it will increase the complications, the rates or the risk rate of complications and death and morbidity. And diastolic is better to maintain in between 70 to 90. Top 9. All the tablets for hypertension got side effects. It's harmful to your kidney. The truth is all medication has side effect, and most of the medications goes through your body it's consumed by your liver and kidney. The metabolism is coming from there. So although all medication have side effects, but as long as the medication have been approved by FDA, the side effects actually is not very severe, or at least in hypertension. In hypertension treatments, the side effects of the tablets is not really severe if you use them correctly. Top 8 is hypertension tablets. You need to change the tablets every few years, because if you use one tablet for quite a few years, after those years the effects will reduce, so the same tablets won't show effect on you. The truth is you don't have to change the tablets if you use the correct tablets for you, the correct types of the tablets for you, and if the tablets didn't show that much or didn't show any side effects on you. In this condition, you are not recommended to change the tablets or change the type of the tablets. Only if you see very severe or you see any side effect, in this case, then you will be recommended to change the tablets. Top 7. Once you discover you got hypertension, it's recommended to control the hypertension as soon as possible. The truth is, although high blood pressure is harmful to our body, but it's chronic, so it's not in one day you got hypertension. It's actually for a long time, few weeks, even few months, even few years. So the blood pressure, when we want to decline the blood pressure, you also need to take time. The recommended time is 4 to 6 weeks to control the blood pressure back to normal, but back to standard. So when we use tablets to control the blood pressure, it's not the quicker the better, because if we decrease the blood pressure, or if the blood pressure drop dramatically, the body is not going to get used to, so the patient will feel some other uncomfortable, or sometimes even for some complications, especially due to the blood pressure drops and due to the blood flow, especially in the brain or in the heart, is not enough. So it's actually harmful to the patient if the blood pressure drops too quick. Top 5. My friend used 8 tablets and it worked very good for him, so I should use the same tablets. The truth is, we got the most common used tablet, high blood pressure tablets for high blood pressure. There's 6 different types, different type tablets. They all got different indications, got different contraindications, and also they have different side effects. So we need to choose the correct tablets for you individually, because different people got different conditions. Sometimes patient A got hypertension and diabetes. Patient B might have hypertension with kidney diseases. So in this case, we need to choose different tablets for different situations. It's recommended to choose the medication with the practitioner, or rather than your friend or someone using the tablets. Top 4. If I don't feel anything uncomfortable, I don't take tablets. The truth is, when the blood pressure increases, some patients will feel headache or dizzy, and there's also a lot of patients they don't feel anything uncomfortable. So the reason of this symptom, the cause or the reason of this phenomenon is because the blood pressure was increased gradually, so the body get used to the blood pressure, so the patient didn't feel, or they don't have any uncomfortable feelings. But no uncomfortable feelings doesn't mean there's no harm to you. Some patients only discovered they have hypertension when they have stroke or they have myocardial infarction. That's very severe complications. So once if you were discovered with hypertension, it's recommended to use tablets to control them, to keep the blood pressure under control. For this, you need to consult with the doctor. Top 3, we talk about Chinese medicine and acupuncture. So for Chinese medicine, in Chinese medicine we emphasize or we focus on individuals. So for different patients or for individuals, we use different formula. In some cases, some patients, when they use Chinese herbal medicine or acupuncture, sometimes the blood pressure can drop. But this is only like rare or isolated case report. In Chinese medicine, we don't actually have a lot cases with hypertension cases treated with Chinese herbal medicine or acupuncture. So we don't have a lot of like data or status to review for the efficacy of the treatment with Chinese herbal medicine. So we don't recommend to use the herbal medicine or acupuncture to treat or to control hypertension at the first place. But Chinese medicine and acupuncture or Chinese medicine or acupuncture can be used to reduce the complications or reduce the uncomfortable symptoms after the blood pressure is controlled. For instance, if the patient with hypertension, after they use the tablets, if they show some side effect, then in this condition we can use Chinese herbal medicine to reduce the side effect. Or if the patient still feel like chest tightness or oppressed chest, or sometimes feel dizzy or palpitation, in this condition we can use Chinese herbal medicine to reduce them, to relieve all these symptoms. But we don't recommend to use the herbal medicine to control the blood pressure. So Chinese medicine, or acupuncture, it's actually not a magic, can be used for any kind of diseases. No matter Chinese medicine includes Chinese herbal medicine and acupuncture. So Chinese medicine and Western medicine, which is conventional medicine, they all have their advantage and disadvantage. So we'd rather to choose which one to use in certain conditions. Top 2 is supplements. A lot of people, they use supplements to control blood pressure, and there's a lot of supplements convince them that they can control and they can heal hypertension. The truth is, all supplements such as hypertension tea or hypertension juice or even hypertension pillow, hypertension hat, you can see a lot of hypertension supplements or funny stuff in the market. All these products, they said that they have the function of healing hypertension. The truth, they don't have any effects of treating hypertension. What's worse is when you're using all this stuff, you actually didn't use the tablets. You actually waste of your time and put your health in risk because you didn't control your blood pressure. top one. It's not recommended to use the tablets because once you use the tablets, you will never stop them. The truth is, the tablets for hypertension is not addicted. So if you want to stop them, if you want to stop to use them, you can stop directly. So you won't be rely on the tablets. The problem is hypertension. Nowadays, there's no treatments to heal hypertension. So we only use tablets to control the symptoms. And control the blood pressure. So once and the tablets got half-life. And the tablets got half-life. So if you take the tablets today, and if you don't take the tablet tomorrow, so after a certain time, when the tablets goes in the body and when they goes out of the body, your blood pressure is going to increase again. So we need to use the tablets again to control the blood pressure. So it's not because the tablets make you rely on them. It's actually because we cannot heal the hypertension so far. So we need to use the tablets to control them. And we forgot top 6, right? So top 6 is we only take the tablets when we found the blood pressure is high. Once the blood pressure back to normal, we stop them. The truth is, we will not recommend it to stop the tablets if your blood pressure is under control with the tablets. So unless your blood pressure is very low, then we can reduce or even stop. We're going to adjust the dosage according to your blood pressure. But if your blood pressure is under control and controlled well with the tablets, you are not going to stop them, because once you stop them, the second day or the third day, the blood pressure is going to increase again, and at last stage, if you take the tablets again, although your blood pressure is going to drop again, but you actually creating the waves. So your blood pressure is at this level. Once you stop them, the blood pressure comes going up, and then you take the tablets again, it's going down. But there's a wave, especially when the blood pressure goes up. It's very easy to cause the complications of stroke and heart diseases. So for the guidelines of the treatment of hypertension, we want to, or it's recommended to control the blood pressure stable to reduce the peak of the waves, the peak of the blood pressure. So once they don't have the gap there, it's safer. So hypertension, these are the top 10 lies around our society or around our friends. Hypertension is not a disease that's untreatable, and hypertension itself is not harmful actually, but the complications is very severe. That's why we need to control the blood pressure well. Thank you for watching our video today. For more information, you can visit our website. You can see our website in the comments. You're welcome to leave any comments under the video.